All right, so your homework for the last week was to practice the body scan exercise. So tell me a little bit about how that went for you.
It went pretty well. There were times, though, where I felt like it was kind of hard to keep my mind on task and focusing on my body because these other thoughts would just pop into my head, and it's sometimes really hard to stay very focused.
Okay. So what you noticed is other thoughts were coming into your head and making it hard for you to focus on the exercise. You found your mind kind of wandering off to other things.
Yes, very frequently.
Okay. Yeah, so we find that that's pretty normal with this exercise and with a lot of different exercises, right? So our minds are kind of constantly going. We constantly have thoughts kind of coming in and going out. And that's completely normal. That's natural. What we want to do when that happens is just notice the thought. Notice that it's there. Kind of let it pass without judging it. And then just gently bring your awareness back to your body. So just let the thought pass and come back to the exercise. Yeah. So what else?
I also noticed that it was just kind of hard to carve out time in the day to make room for the exercise. It can get really busy sometimes, and having an extra 15 or 20 minutes to do a body scan isn't always feasible.
Okay. Yeah, it was kind of difficult to find time during your busy day to do the exercise. Okay. Yeah, so when were you typically trying to do the body scan during the day?
I would end up most of the time doing them at the end of the evening once the day was kind of coming to an end, but then sometimes I would just get so tired that I would just end up falling asleep and not doing them.
Okay. Yeah, so you find that waiting until the end of the day is not the best. You end up thinking that you're going to do the body scan and then just falling asleep instead.
Yeah.
Okay. Yeah, so do you think it might be easier to try doing the body scan at the beginning of the day when you don't have as much on your mind, when you're not as kind of emotionally exhausted from the day?
I think that could definitely be worth a shot.
Okay. Yeah, so maybe starting your day off with the body scan and seeing how that goes might be helpful.
I think one of the other things that I really struggled with as well was just when we're noticing all of the different parts of our body and how they're feeling, and sometimes my elbow doesn't have a feeling, or I wasn't in touch with it if it was having a feeling, and I was supposed to notice it, but I didn't have a feeling. So I think that was one of the things I struggled with.
Sure. Yeah, so that's completely normal as well. It's completely fine. So in some parts of your body, you might notice that you don't really feel any sensations, or you don't really feel anything happening, and that's completely okay. So like you mentioned, in your elbow, for instance, or in your ankle, certain parts of your body, you might not feel anything, and that's okay. So just kind of allow yourself to recognize that there really isn't any sensation, and just accept that, just like you would if there was a sensation. So it's not good or bad to kind of notice the sensation. It's just about noticing whether or not anything is happening.
That was one of the things I was working on when I was noticing that my back was hurting, and my thought was oh, well, that's bad. But I remember we had talked about it not being good or bad. It just was.
Exactly. Yeah. It's all about just accepting what you feel. So if you notice your back hurting, that's not good or bad in itself. Just noticing the sensation is the purpose of the exercise.
Otherwise, I really enjoyed the exercise. I thought it was really nice, and it was kind of calming, and I think that each day it kind of got a little bit easier with some of these problems I was experiencing. They seemed to, I had less thoughts jumping into the body scan at the end of the week than before the beginning.
Excellent. Yeah, and you might notice that as you practice more often.